All right, so welcome to another deep dive, you guys. Today we're going to be looking closely at this measles outbreak in Texas.
Yeah,
And, this is kind of a big deal because it's resulted in the first measles-related death in the U.S. in over a decade.
absolutely.
And we've got some pretty interesting sources here.
Yeah.
We've got reports from the Texas DSHS and even an op-ed by Robert F. Kennedy Jr.,
Right.
who, as you know, is the Secretary of Health and Human Services.
So that's a big story. A lot to unpack.
Yeah, a lot to unpack.
Yeah. It's it really highlights how fragile public health is.
Right.
We kind of take it for granted sometimes.
Yeah.
And this is a reminder that we can't let our guard down.
Exactly. And it's like, we think about measles and it's almost like something out of a history book.
Yeah.
It's not something that we really think about as a present day threat.
Right.
But so let's dive into some of the details here.
Okay.
The Texas DSHS reports lay out the situation really clearly.
Mm-hmm.
It all started in late January of this year. And as of March 2nd, they've confirmed 146 cases.
Wow.
And most of these cases are concentrated in the South Plains region
Okay.
and involve children under 18.
Yeah, and this is the part that really hits home for me.
Yeah.
116 cases in children.
Yeah.
It's just a stark reminder that they're the most vulnerable in these situations.
Yeah. It's hard to think about.
Especially when you consider how contagious measles is.
Right.
It spreads through the air. So just imagine,
Wow.
someone coughs or sneezes.
Yeah.
You can have these really serious consequences.
It's like almost stepping back in time, isn't it?
It is.
And speaking of history, the fact that a school-aged child in West Texas died from this measles outbreak
Oh, wow.
is just a huge reminder of the time before the vaccine.
Yeah.
It's the first U.S. death in over a decade.
It's chilling to think about.
Yeah.
Before the vaccine was widely available, the U.S. saw over 500,000 cases every year.
Wow.
And the death rate was 1 in every 1,205 cases.
It's mind-boggling
Right.
to think about that.
It really puts things into perspective.
Yeah.
How far we've come.
Definitely makes you appreciate the progress that we've made in terms of public health. But
Right.
this outbreak kind of throws a wrench in that narrative, doesn't it?
It does.
Especially when you look at the vaccination data from the Texas DSHS.
Mm-hmm.
Out of the 146 cases, 79 were unvaccinated.
Okay.
62 have an unknown vaccination status.
Okay.
And at least 5 of the people who got sick were actually vaccinated.
So how is that possible?
Right.
That's the big question.
Yeah. So how are people who are vaccinated still getting sick?
Well, that's where the concept of community immunity comes in.
Okay.
When enough people are vaccinated, it creates a sort of shield.
Okay.
Even if some people aren't vaccinated or if the vaccine isn't 100% effective,
Yeah.
the disease has a much harder time spreading.
Right.
But when those vaccination rates drop, that shield weakens
Okay.
and then outbreaks become more likely.
So it's kind of like a domino effect. One person's decision not to vaccinate can really impact the entire community.
It's a ripple effect.
And that brings us to the government's response.
Right.
Robert F. Kennedy Jr., who's the Secretary of HHS,
Yeah.
has expressed, deep concern about this.
Mm-hmm.
And he's directed federal agencies like the CDC and ASPR to provide full support to Texas.
Well, that's great.
And he's even taken the time to speak directly with Governor Abbott
Mm-hmm.
and the parents of the child who passed away.
That's a really personal touch.
Yeah, it seems like a really hands-on approach.
Definitely.
So the support from HHS that's coming in
Yeah.
it's multifaceted. There's a lot going on here. We're
Yeah.
talking boots on the ground in terms of technical assistance,
Right.
lab support to help track the virus,
Okay.
and of course making sure there are enough vaccines and medications available.
So they're really pulling out all the stops.
Yeah, it seems like they're really trying to tackle this head on.
Mm-hmm.
The CDC even updated their recommendations to include vitamin A
Oh, really?
for measles patients.
Interesting.
Have they always recommended that?
Not always. It's based on new research showing that vitamin A can actually reduce mortality rates.
Wow, so they're really leaving no stone unturned.
It seems like it.
It's not just about the immediate response, though, right?
Yeah.
Kennedy wrote this op-ed for Fox News,
Okay.
and he called this a call to action to protect public health.
That's powerful.
Yeah, and he's really pushing for accurate information about vaccines to be available
Okay.
and for communities to have their concerns addressed.
Yeah, that's a key point.
So it's not just a medical issue.
No, it's a social one, too.
It's about how we communicate about vaccines, how we build trust with communities,
Absolutely.
how we make sure everyone has access to them.
It's all connected.
So it's not just about the science, it's about the people, the communication, the trust.
Exactly.
And Kennedy even touched on the importance of nutrition in his op-ed,
Oh, interesting.
specifically mentioning vitamins A, C, D, and B12
Okay.
as a way to kind of bolster our defenses against illness.
He drew a parallel to the past,
Oh,
noting that improvements in sanitation and nutrition played a big role in reducing measles deaths,
even before the vaccine.
even before the vaccine.
So it's like having multiple layers of protection.
Exactly.
All right, so we've got the outbreak itself, the government response, the call for accurate information, the emphasis on overall health.
Right.
There's another group we haven't mentioned yet,
Who's that?
the healthcare workers on the front lines.
Oh, of course. The people actually dealing with this outbreak every day.
Yeah.
In his op-ed,
Yeah.
Kennedy praises their dedication
Right.
and emphasizes the need to give them all the resources they need.
Yeah, they're the ones putting themselves at risk to care for the sick
Absolutely.
and prevent further spread.
Their role is absolutely crucial.
Their role is huge.
Yeah, they're the backbone of our public health response.
Makes sense.
Yeah, it really makes you realize that it takes a village,
Yeah.
to combat an outbreak like this. Everyone from healthcare workers to government agencies to just regular people in the community.
Right, and it seems like that shared responsibility ties directly back to the discussion about vaccination.
Absolutely.
Like we're walking this tightrope between individual rights and the well-being of the entire community.
Yeah, you hit the nail on the head there. That's the big debate, right?
Yeah.
The tension between respecting individual choice
Right.
and making sure everyone's healthy.
Especially those who can't be vaccinated.
Exactly.
With medical reading.
Like, people with compromised immune systems.
Right.
They rely on that community immunity.
And Kennedy seems to acknowledge both sides of this issue.
Yeah.
In his op-ed, he says, the decision to vaccinate is a personal one.
Okay.
But then he immediately goes on to emphasize the importance of community immunity
Right.
and protecting those who are most vulnerable.
So it's like he's trying to balance those two things.
Yeah.
Personal freedom
Right.
with the needs of the community.
It's like dropping a pebble in a pond.
The ripples spread out,
I do.
far beyond that initial point of impact.
And in this case,
And sadly, in this case,
we're seeing the very real consequences of those ripples.
yeah, with the death of that child in Texas.
It's a tragic reminder that this isn't just an academic debate.
Yeah.
This is real life.
Right.
Infectious diseases are still out there.
Yeah.
And this outbreak is a wake-up call.
So where do we go from here?
Well, that's the million-dollar question, isn't it?
It is.
I think the answer involves a lot of different things.
Yep.
First, we need to make sure everyone has access to accurate information about vaccines.
Okay.
That means fighting misinformation,
Right.
addressing people's concerns, but doing it with empathy and respect.
So it's about meeting people where they are.
Exactly.
Having those open and honest conversations.
Yeah. Building trust.
Yeah.
Trust in healthcare systems, trust in scientific expertise.
And alongside education,
Yeah.
we need to strengthen our public health infrastructure.
Right. Think surveillance monitoring, rapid response, clear communication.
Like having a well-oiled machine ready to go
Yeah.
at a moment's notice.
Exactly.
But it's not just about reacting.
Okay.
It's about being proactive, too.
So what does that look like?
Continued investment in research and development
Okay.
for new vaccines, new treatments.
So we can't just rely on what we have now.
No, the world of infectious diseases is always changing.
Right.
We need to stay ahead of the curve.
It's a combination of being prepared for the present and looking ahead to the future.
Exactly.
This outbreak has really highlighted how closely individual health and community well-being are tied together.
It's all interconnected.
Yeah.
We need individuals taking care of themselves,
Right.
communities supporting each other, and systems working effectively to protect everyone.
Especially the most vulnerable.
Absolutely.
Yeah, it really does make you think about the bigger picture, doesn't it?
It does. And you know what? This measles outbreak, while it's definitely concerning, it's also an opportunity, I think.
Okay.
A chance for us to learn and adapt and build a more resilient future.
Yeah.
Public health is a journey, not a destination.
That's a good way to put it.
We're always learning. We're always facing new challenges.
So as we wrap up this deep dive into the measles outbreak in Texas, what's the one key takeaway you hope our listeners walk away with?
I think the most important thing to remember is that public health is a shared responsibility.
Okay.
We all have a role to play in keeping ourselves and our loved ones and our communities safe.
Right.
Whether it's staying informed about these issues, choosing to vaccinate,
Yeah.
or advocating for policies that support public health,
Right.
we can all make a difference.
And I think it's so important to remember the human element here.
Oh, absolutely.
Behind all the statistics and the data
Hmm.
are real people, real families, real communities
Right.
dealing with this outbreak.
The healthcare workers on the front lines,
Yeah.
the families facing illness and uncertainty.
It's easy to forget that sometimes.
It is, but there's so many stories of resilience and compassion
Yeah.
and strength coming out of this.
It's a good reminder that public health isn't just about numbers.
No, it's about people.
It's about people.
At the end of the day, it's about working together so everyone has the chance to live a long, healthy, and fulfilling life.
And on that note, we'll leave you with a final thought to ponder.
Okay.
We've talked about the history of measles, its near eradication, and now this resurgence.
Right.
What does this tell us about the challenges of maintaining those public health victories in the long run? It's something to think about as you continue to learn and explore.
Is food for thought.
Until next time.